Okay, it's going to be a scorcher today.
Whenever it gets hot in California, you always have to worry about fire.
But listen, heat-related illnesses and death are actually very preventable. So what are some things that our community can do better to stay safe in this heat crisis?
Don't forget to like and subscribe, as well as share and comment below, as it helps to grow our channel as well as our community.
Some of the patients in our community that suffer with sensory disabilities and movement disabilities and take medications even, here are 5 tips to help you weather this heat storm. So temperature regulation tends to be a problem in some critical diagnoses like patients with spinal cord injuries or multiple sclerosis. As a result, you need to be mindful of things like transferring into those questionable other seats. Because of sensory and temperature regulation issues, it's difficult to assess whether or not the seat is hot. Take a quick minute, drop your windows, allow the car to run, get a caregiver or a friend to turn on the car and allow the car to run a little bit, cool off before getting into the car. To get in and sit down and not have to worry about burning your legs and thighs.
Here's how to make the easiest, crispiest roast chicken ever.
You'd be surprised how often it happens. Leather and vinyl can be extremely hot, especially when the temperatures rise to the levels they're expected to rise to today. Second point of advice is medications. Be advised that sometimes heat can affect how your medications work and can sometimes have an adverse effect with exposure to extreme heat. If you're not sure about what your medications or side effects that may come with utilizing certain medications in the heat, try and reach out to your primary healthcare provider, nurse practitioner, or physician, as well as your pharmacist to see how heat may affect you when you're taking certain medications. Find out and learn before heat waves come along where your cooling centers are in your area.
With the heat wave hitting Southern California this week, dozens of cooling centers have opened across LA County. They are all listed at ready.lacounty.gov, and most public libraries are also doubling as cooling centers.
If you're not aware of any cooling centers, feel free to call your city or go on their websites to look for cooling centers or Google cooling centers, which cooling centers are out there in your area. And if you're not sure, there are these things called malls and libraries that are great places to kind of weather the storm, as long as you possibly can. In the meantime, stay hydrated. Like we talked about the medications earlier, some medications have an effect of dehydrating you. As much as you possibly can, try and stay hydrated. If you have kidney problems, consult with your physician to find out what works best for. One other thing to say about hydration is, remember when you hydrate, you have to urinate. So create a plan. If you're going to hydrate, try and create a grounded plan so that you're not rushing to get to the bathroom, because nothing increases your risk more for falls than rushing to the bathroom. Hydrate, urinate, hydrate, urinate. If you're going to hydrate, make sure you set a plan to be able to access the restroom in an adequate amount of time so that you're not rushing to get there. Finally, simple cooling measures like a cooling towel can sometimes help to mitigate heat. With a nice towel underneath some cold water, wrap it around your neck, and it's a quick and simple cooling strategy over your head and around your neck to help cool off quickly. Sometimes it's helpful when you're outdoors, but try and avoid the outdoors if you possibly can, if you need to. Also, for our patients with pulmonary problems, be advised that sometimes the air quality is also not as great when you're out and about during the course of a heat wave. So try and stay indoors as best you possibly can. Be mindful of where your rescue inhalers are, keep them close and safe, and make sure your portable oxygen tanks have an extra charge. Heat advisories often result in power outages because of the load on the electrical grid. So make sure you always have a backup electrical charge on your portable oxygen tanks, and that if you have a K-tank at home, a bigger oxygen tank, that your oxygen tanks are at adequate level. Call your vendor and reach out to them early. The key is preparation. Try as best as you can to maintain a level of preparation, so when things like heat advisories take us by surprise, that we'll be prepared when disaster strikes, because it's not if it'll happen, but the question is typically when it happens. And for all those who stayed along to listen, some of these actually apply to able-bodied people just as well as people with disabilities. Extreme heat can be dangerous for anyone. Also, don't forget to check on our friends and our neighbors who are out there that may need additional help to get around or stay mobile, or most importantly, stay safe. And always remember, if someone who sweats naturally stops sweating, that can be a sign of heat stroke and can be an immediate medical emergency. So always call 911. Anyway, stay cool, stay hydrated, and let's look out for one another. That's my time. I'm Dr. Hansen here at Corona Hills Physical Therapy and Wellness, and we're up. Thank you again for watching this video. We hope that you enjoyed it. Please like and subscribe and leave comments below. Tell us what you think. Also, let us know if there's any content that would interest you to see on our channel. Take care, be safe, and we'll see you soon.